gotten vaccinated for COVID-19, the only proof you have right now is a little handwritten card. It's easy to forge and it's already been happening. But there is a push to create something more advanced that could be easily verified. We spoke to a doctor with UC San Diego Health who explained how it would work. At Petco Park this season, there's a non-socially distanced section, but it's only for people who've been vaccinated or recently tested negative for COVID. It's an example of what some think might become the norm for large venues.
In order to do that, we'll want to be able to offer this vaccine verification.
Dr. Christopher Longhurst is with UC San Diego Health. It's one of a growing list of institutions working with a group called the Vaccination Credential Initiative. Its goal is to create a system that produces verifiable copies of your vaccination record that could be accessed on your mobile devices or printed out.
We want people to think about this like flying. You know, when you walk up to the airlines, some people have printed boarding passes with QR codes, and others have their smartphones, and they're showing the QR code on their smartphone.
Right now, both the state and federal government have said they won't make vaccination mandatory. But Longhurst points out there are plenty of other reasons you might need to show proof.
So, for example, traveling internationally, other governments still require this. And live venues, as we mentioned, may be a place where we can get more capacity if you show proof of vaccination.
Right now, Longhurst estimates it'll be at least a few months before a so-called health pass system could be up and running.
I don't think that mandating vaccination is the right solution. I think that we can incentivize it, and part of the incentive is allowing people who are vaccinated to do more things in these crowded venues than those who are unvaccinated.
Right now, California's reopening rules allow private companies to hold larger events if they require proof of vaccination or a negative COVID.